Essential tremor is a condition that is often genetic. It's familial. It runs in families, and it causes tremors often in the hands. People can have varying degrees of the tremor, some very severe, some not so severe. But in its more active forms, it could be quite disabling. It could affect someone's ability to use their hands. For example, drinking a cup of coffee, tying their shoe, writing becomes enormously challenging for these patients. And slowly over time, they start to lose their independence. Even though it is not a life-threatening condition, it really does affect quality of life in significant ways, both for work and for social. So often, because there is no effective treatment options, patients just give up on treatment. They go to see a few neurologists. They may be tried on different medications and they may have side effects, or the medications may not be effective, and they give up. They just live that way for years. Up until very recently, the only other treatment we had besides the medication that's available for these patients was surgery called deep brain stimulation, where we implant a pacemaker in the brain. Actually, it's quite effective in treatment of the tremors, but it is surgery, and it carries risks of surgery, which we try to, of course, keep at a minimum, but still the risks are there. And it requires a lifetime of follow-up and maintenance and adjustments, and the pacemaker battery needs to be changed over someone's lifetime. So it is a commitment. But more recently, we have a few additional options that really have changed the landscape of how we treat patients with essential tremor. The most effective and the most impressive one is something called focused ultrasound, where we use sound waves that are able to pass through the skull without any incisions, without any surgery, and they coalesce on a spot in the brain that we know is involved in generation of the tremors, and they cause a small ablation in that area, and that they arrest the tremors. And often this is a permanent treatment. Now, there could be recurrence of about 10%, but often patients have tremor relief for years after the procedure. Another addition to the treatment of tremors are newer wearable devices. Although not perfect, they do offer some relief for some patients, and they're not invasive, and the risk is minimal, essentially. So patients have a variety of options to choose from. Of course, we try the least invasive way, and often medication is all we need, even if their tremors are severe.